Students, let's quickly revise AMTSL, Active Management of Third Stage of Labor. What are the advantages? It reduces bleeding to almost 50% of the normal. It reduces the chances of PPH and it reduces maternal mortality. The third stage duration is reduced to almost 5 minutes. That is almost half of the normal without AMTSL. These are the advantages. What is the only disadvantage? The higher chance of manual removal of placenta because of retained placenta. What are the four components of AMTSL? The first component is giving oxytocin to the patient within 1 minute of the birth of the baby. Second is delayed cord clamping. By delayed cord clamping, you mean 1 minute after the delivery of the baby. So within 1 to 3 minutes of the delivery, you do the cord clamping. Third is control cord traction for the placenta, delivery of the placenta by CCT. And the fourth is intermittent uterine tone assessment. Remember children, intermittent uterine tone assessment is a part of AMTSL, but uterine massage is no more a part of AMTSL. It is a part of PPH management. So in AMTSL, you don't do uterine massage. The most preferred drug for PPH is oxytocin. The dose is 10 units, either IM or IV. IV bolus can lead to transient drop in the blood pressure. It can lead to cardiac arrest. It can lead to myocardial infarction. So IV bolus is not given. When you give IM, the mode of action starts from 3 minutes and stays up to 3 hours. If you give it in the IV infusion form, then the immediate action happens. It doesn't take 3 minutes to act, but the action lasts only for 1 hour. Other drugs recommended are argometrine 0.25 milligrams, which can lead to tetanic contractions. So it is only used in AMTSL. It is not used for induction of labor. Then the other drug is symptometrine, which is a combination of oxytocin with argometrine, which is very effective but slightly expensive. Then the next drug which is recommended is PGE1, that is prostaglandin E1, also known as misoprostol. WHO recommends its use in the dose of 400 to 600 micrograms orally or sublingually, but not rectally. Per rectally recommendation is only by ACOG. There are 3 drugs which are not recommended by WHO but are still used in PPH. What are those? Carboprost. Carboprost is what? It is prostaglandin F2 alpha, that is very commonly known as prostodin. It acts only on the myometrium and it is not recommended in PET, PIH. Hence, it is only recommended for management of PPH but not recommended by WHO. Then comes PGE2, which is dinoprostone. Now, this one is not recommended by WHO because it can lead to low blood pressure. And the third drug which is not recommended is carbitocin, which is an analog of oxytocin. It has a better half-life, better action, but again, it is expensive and not recommended by WHO. Second component of AMTSL is delayed cord clamping, means within 1 to 3 minutes of the delivery of the baby. If it is done before 1 minute, that is known as early cord clamping. Advantage of delayed is you give extra 80 ml of blood, means extra 50 milligram of elemental iron to the baby. That is why it is recommended by the Government of India in the Anemia Mukt Bharat program. Okay. Third component is what? It is control cord traction, placenta delivery by modified Brand-Andrews method. It can be done 3 times. First, it is done after delivery of the baby. After 2 to 3 minutes, you try it again. If it doesn't budge, if it doesn't come out, you try it again after 10 minutes. Even after that, if it doesn't come out, then it is categorized as retained placenta. So what is retained placenta? If the placenta doesn't deliver within 30 minutes of the birth of the baby. Fourth component is intermittent uterine assessment for the tone assessment, and that is to be done every 15 minutes for the first 2 hours. No uterine massage is done in AMTSL. That is all. Thank you.